Hello everyone, today we'll discuss about myasthenia gravis. Now, what is myasthenia gravis? It is a serious and sometimes fatal autoimmune disease, okay, and in which skeletal muscles they become weak. Okay, here pathology. What is the pathology of myasthenia gravis? Here you can see myoneural junction is not able to transmit the signals. Okay, from the nerve fiber to the muscle fiber. Here this is normal neuromuscular junction. Impulses are transmitted from nerve fiber to the muscle fiber. Here in myasthenia gravis, there is no impulse transmission, and that results in paralysis of the involved muscle. Now, what are the etiology of myasthenia gravis? Here you can see autoimmune disease. So auto antibodies they produced against acetylcholine receptor. You can see here this is the acetylcholine which is released from presynaptic neuron which is having this vesicles. They secrete acetylcholine. Now this acetylcholine binds with the receptor present on the postsynaptic membrane. Here postsynaptic membrane receptors has there are antibodies that are produced against this receptors. Okay, the cause is unknown. There are three major actions of this antibodies, anti-acetylcholine receptor antibodies. Number one is they compete with the acetylcholine and they bind with the acetylcholine receptors, and therefore the receptors they get blocked. Second thing, they cause endocytosis of the receptor. Receptors they get enter inside, so number of receptor decreases. And third, they also cause damage to the postsynaptic membrane. Fine. So these are the three etiology of myasthenia gravis. Now, what are the clinical features? You can see here, because of the lack of neuromuscular transmission, the person is having rapid onset of fatigue with marked generalized weakness of the muscle. Muscle weakness is there. Okay. Weakness increases during prolonged use of the muscle, and weakness decreases when person takes rest or sleep. Okay. Commonly small muscles are involved, like extraocular muscles are involved, muscles of the lead they are involved. Okay, so the person is having ptosis you can see here, that is drooping of eyelid, either one or both the eyelids they droop down. Second is double vision, diplopia, because of the damage to the extraocular muscle muscle contraction is affected. Okay, face and throat muscles are also affected, so the person is having dysarthria, difficulty in speech. The person is having dysphagia, that is difficulty in swallowing, chewing. Okay, person is also having difficulty in the facial expression, as well as neck and limb muscles are affected. That results in weakness in the arm, weakness in the legs, neck and fingers. They also feel there is also weakness in those muscles. Chest muscles are also weakened, and it results in respiratory failure, and that is serious condition that may result in death of the individual also. Okay, now how to treat the myasthenia gravis? One, that is one can administer acetylcholine esterase inhibitor, like the drugs given, that is neostigmine and physostigmine. These drugs they inhibit the acetylcholine esterase. Okay, that is one mode of treatment. Second mode of treatment is thymus is removed, thymectomy, because if we remove thymus, immune response decreases. So when immune response decreases, that shows improvement in the autoimmune diseases. Okay, another is plasmapheresis. Here what we can do is we just have to remove the plasma, and we have to give the RBC suspended in the isotonic solution. So here plasmapheresis, when we are removing plasma, acetylcholine receptor antibodies which are present in the plasma, they also will remove, so the person feels improvement. And another mode of treatment, that is immunosuppressive drugs are given, but this is not very much advisable because it suppresses immunity also. Immunosuppressive drugs given, they are glucocorticoids and azathioprine. These are the drugs which are given to suppress the immunity and decreases the production of autoantibodies. Okay, so this is about myasthenia gravis. One another disorder which is having similar symptoms to the myasthenia gravis, but the pathology is different. That is Lambert-Eaton syndrome here. This is also an autoimmune disease here, but antibodies are produced against calcium channels here. These are the calcium channels which are present in the presynaptic terminal. So against this channel, antibodies are produced. So this calcium ions cannot enter in the presynaptic terminal. So there is no bursting of vesicle and no release of acetylcholine. And when acetylcholine is not released, what happens? Same thing is there. Acetylcholine reduces, so there is decrease in the neuromuscular transmission. So the symptoms are same. Okay, you can see here, because of decreased calcium entry, you can see here decreased release of acetylcholine, and end plate potential and action potential cannot be generated. So the person is having muscle weakness, but the pathology is different. Here pathology is antibodies are produced against against calcium channel. Okay. So, another important thing here, if in Lambert-Eaton syndrome, repeated stimulation of the nerve is given, then that results in incremental response. That is because of increase in the calcium channel activity, and because of accumulation of calcium, some amount of calcium may get entered, and that results in release of acetylcholine. Okay, so this is Lambert-Eaton syndrome. So this is all about myasthenia gravis and other autoimmune disease, that is Lambert-Eaton syndrome. Thank you so much.